So my name is Nikki Akbariwa, and I identify as a Black woman. And nursing is something that I absolutely love. I had the opportunity to go do a program at Duke University, which was the Minority Medical Education Program. And there were all these beautiful Black and Brown people that were there aspiring to be doctors. And believe it or not, it was then that I realized I didn't want to be a doctor. Like I couldn't come up with statements. One of the people that came with us, she was in nursing school, and she is Native American, and she was practicing one of her clinical skills in the tribe. So she was working with pregnant moms in the tribe, and I said, "Oh, you can do that as a nurse?" And she said yes, and that was what happened. That's what did it for me, because I knew I didn't want as much of that bedside. A lot of people get excited. I wasn't jazzed about that so much. I was really jazzed about how do I connect back to my community. And when I found out you could do that, I started pursuing that pathway. But nursing school, probably like other professional degree programs, was very intense. So I think about it as and compare it to dentistry and pharmacy and medicine. It was very intense as a process. And I don't think I knew that that's what it was going to be like. I don't know what I expected from it, but I didn't know that it was going to be so much work and so much emotional and mental processes and physical, right, go into nursing. It's all of it. And that's what makes nursing so unique is that we use all of ourselves, like all of our knowledge and skills, but our bodies as well, and moving patients and rolling and feeding and caring, all of those things really do get integrated into, all of the things that we do in nursing. And I had many incidents, times in nursing school where I thought this is not uh, I don't know if I'm going to make it through. And I have some stories even to share about that, with just those feelings of not belonging, and not really feeling like I was connected, even in nursing school. I went to the University of Washington School of Nursing, and that was a very competitive program. I was directly admitted into school, which was wonderful, but we didn't have very many Black and Brown people in the program, right? So I could probably count on one hand all of us that were present in the program, and not very many men or folks that identify as men that were in the program either. And so that it didn't become really real to me until I started working in a program. And like other nursing schools, most of, if not all, the faculty were white women that were nursing faculty. Same with my clinical instructors, all of them were white women. And so, again, you have this, there's who else it can relate, who is like me, these experiences. So when you have things like that happen, it's almost like, what's the next thing to do? What am I supposed to do? I had a couple of experiences, even in my clinical sites. I remember two experiences in my clinical sites where, again, it came down to I felt like I was battling and fighting my instructor. And I didn't know why, because I was doing so well in school. My grades were fine, but it was these things, and they weren't telling me what I was doing wrong, at least not in a way that I could clearly understand. And I'm like, I can't see what else this could be about. But why would it be that? Because it wasn't, they weren't obviously telling me this is because you're Black. That's not how it happens. And I think that part is a part of the emotional trauma that goes into this, is no one's saying it directly. It's very passive aggressive behaviors that make you feel as though you don't belong and you can be easily excluded or even tossed aside. But I had a charge nurse who, on a day where I was drowning with patients, I had three patients. It was a crazy shift anyway, because our computer system was down. So everyone was struggling. I had a patient who was constantly pooping. Okay. So it's a code brown, as we call it, where, you have to gown up and go in. And I had another one who was combative. and who was pulling out all his lines, and we were trying to restrain him. And this patient really needed a higher level of care. And I was trying to go to my charge nurse to advocate for the patient and to advocate for myself and say, listen, I just don't think that even with these three patients that I have, it's an acute care setting. So I tried to say this to her, and she basically fanned me away. She said, nope, we're not doing that. She just told me, we're not doing it. We're not, he's going to stay right here and you're going to take care of him because you have to learn how to take care of really sick people. That's what she said. Okay. So then, thankfully, when the medical team rounded, I spoke up and I told the team and the attending, I think this person needs to be in the MICU. I think that they're too sick to be on this floor. These are the reasons why. Thankfully, learned that in nursing school, how to use my critical thinking processes, right? These are the reasons why I think he's too sick. I think we got to do something now. And thankfully, they did. I couldn't believe it. They said, yes, we will. So they started to initiate the transfer. When my charge nurse found out about it, she was so upset, very much so passive aggressive, the nonverbal kind of throwing things. And I mean, it was part of her job to come and tell me, that the person needed to be transferred. She didn't even want to tell me. She was very much so behaving in a way that was incredibly unprofessional. And to make matters worse, on the type of unit that I, grew up in, as I like to say, these types of behaviors happen in front of our patients. They happen in front of other staff members. I heard my nurse manager talk about other staff members in front of other patients and in the middle of hallways. I saw other nurses, other Black nurses, and there were only a handful of us in a critical care unit. I saw them being told that if they felt like they needed to take additional vacation, they might as well go ahead and leave. They didn't have to come back. And meanwhile, there was a white nurse who had a patient that she left sort of unmonitored on his own to do his own HIBA cleanse, which is the surgical scrub that you do before you go to surgery. Left him alone to do it. So this patient unplugged all of their the monitoring device, came off of the monitor, which you're never supposed to do in a cardiac unit. And unfortunately, this patient coded and died. Someone found them. That is correct. I said it. Coded and died. Now, historically, what they did on the unit, if those types of incidents happens, of course, this is a sentinel event, but you don't get cross-trained to the ICU because we were in both. We had an acute care and an ICU. They cross-trained this nurse, and I want to say it was within a matter of weeks to months that they just brushed it completely aside while I saw other people struggle for over a year to get into the ICU. You see what I'm saying? So there were these instances that to me were very clear in my mind that, Nikki, if you want to stay in this place at the bedside in these ways, you're going to have to continue to conform to, the way people think and the way that they perceive you and they act around you. And that wasn't a space that I wanted to stay in. And so I found another space to go into. The disconnect that happens with people is that white folk have a tendency to believe that they are outside of the context of anything that occurs with race. Okay. So if you have a practice or you have people it's a predominantly white profession where we are, who really believe that the experiences and things that happen don't matter the same way in the same ways because they're not happening to them, there's always going to be a disconnect if we believe or if they believe, well, it's not as big of a deal. It's not as important. We don't really need. So it's where our value lies. And it's a matter of understanding better. What is it that we're really trying to get to? The heart of our work as nurses, to me, is justice work. Okay, that's the big umbrella to me. This is about the work of justice. Yet at the same time, what we're not understanding is that there's a thread that runs through all of these communities. And if we're not able to look at what is happening in real time and have a better understanding of what the challenges are, then we will continue to miss out on ways in which we can promote health equity. So we have not given ourselves the space that we need to really explore everything that nursing is really all about, right? When I think of nursing, the reason why I wanted to do public health and population health is because it encompasses everything. We get to look at all populations and systems. We've been ingrained and indoctrinated by media, by history, by everything that people start to practice on the biases that they don't even think that they have. But those unconscious biases have real impacts and do play out in real time with people. And so I think if there was a greater appreciation for how biases actually do play out, I believe that folks would have a better understanding of ways to address it when they really see it. So it wouldn't be a situation in which they are, noticing it and not doing anything about it. It's not enough to say, I'm not racist or I don't do what that person does over there. We are at a place where we as nurses must actively engage in addressing, looking at our biases, and then becoming anti racist in our practices. If this is a person that wants to make a difference in the world and wants to make an impact and really values, justice and equity and inclusion and wants to put that to work, this is a great place for them to do that. There's so much work that needs to be done. And I would tell them that we need more people who want to be educators, who are educators of color. We need more that want to be nurse practitioners and pursue their doctorate. We need more because what we have found also in nursing and in medicine in general is that when we are cared for by each other, by our people that look like us, we actually have better health outcomes than when we are cared for by people who do not look like us. Okay. So we need more of us in this profession so that we can make an impact really on the overall health and really begin to change the landscape that we see in this country as it relates to all these chronic illness and the disease burden that we're seeing in BIPOC communities. Taking time in the day to pause and breathe, that's one of the most profound things you can do for yourself is to pause and give your body a breath to reset or just stepping away from things for a moment and coming back to it, realizing that you're not going to be able to do it all overnight, that you're going to have to take some time, you're going to have to link arms with other people to do it. All of those things, they help me move forward. And then maybe the biggest thing is we're in a place and space where there's a movement happening right now. This is giving me strength. It's the wind beneath my wings right now to know that we're in a movement and there's a lot of collective energy around transitioning and changing and transforming the ways in which we look at ourselves in society and how we look at ourselves as nurses. So that has given me a lot of strength to continue going on.